Welcome to this third installation of Millennium's Peptides for Health series. Hello, I'm Dr. Mark Gordon, Medical Director of the Millennium Health Centers, where we provide leading-edge technologies that address regenerative and functional medicine. We are probably more known for our groundbreaking work with symptomatic traumatic and non-traumatic brain injuries in civilians and military communities. Understanding the mechanisms by which subconcussive and concussive brain injuries influence our personality, mood, and intelligence has provided us with effective treatments to fix the underlying problems. In this presentation, we will discuss some of the benefits of TB500 when used by itself and also in combination with other key peptides. If you would like to read more about TB500 and other peptides, please go to our educational website, tbihelpnow.org, under the coming news section, Peptides for Health. So now let's learn about TB500. Thymosin beta-4 is also referred to as thymosin 500 or TB500. Over 60 years ago, this 43 amino acid length peptide was isolated by Dr. Goldstein and his team while working at Albert Einstein Medical Center. Dr. Goldstein was investigating the different peptides produced by the thymus gland located in our necks, which is an important part of our nascent immune system. He found many peptides, but the TB500 was the most abundant and the most biologically active peptide within the group. TB500 has over 9 well-documented actions in our body, in addition to those listed on the slide. TB500 has shown a significant potential for accelerating healing of chronic wounds such as diabetic ulcers and pressure sores. TB500 enhances cell migration and helps to increase blood vessels in challenged healing environments. TB500 is a key peptide used in sports medicine for its ability to accelerate repair of muscles, tendons, and ligamental injuries. Athletes are using TB500 to recover rapidly from strains, tears, and overuse syndromes. TB500 has shown potential in protecting heart tissue from progressive damage due to an acute heart attack. In my world of traumatic brain injury, precipitated neurodegenerative conditions such as Alzheimer's disease and Parkinson's disease, the neuroprotection conferred by TB500 helps to slow the progression of these diseases by protecting neurons and supporting tissue repair. Synergy is the interaction of two or more agents whose combined effect is greater than the sum of their individual effects. On the left are the benefits derived from each of the peptides, and on the right are the effects when all three are used together. A copy of this chart will be available at tbihelpnow.org under the pending news section, Peptides for Health. In 2019, the Millennium Health Centers developed an orthopedic tripeptide protocol which takes into consideration the synergistic benefits from IGF-1, BPC-157, and thymosin 500. Their combined effects optimize the regeneration of damaged tissues. In this case, an incomplete tear of the rotator cuff responded in 6 weeks using the stated protocol. The synergistic effects of combining these three peptides has led to the recovery of orthopedic conditions that commonly require surgical intervention. In this case, the onset of symptoms was precipitated by lifting 20 50-pound boxes. The MRI shows a structural problem with compression of the spinal cord at C4-5 with impingement. The patient was unable to lift their arm with more than 2 pounds in his left arm above the shoulder due to compression damage and inflammation affecting the long thoracic nerve. After 2 6-week cycles of the tripeptides, there was resolution of pain and some recovery of lifting, which improved over 3 months. I want to make it clear that the MRI shows a structural problem causing the symptoms, but after 12 weeks of treatment, the symptoms were gone, and he was able to rehab his left arm. We know that the peptides do not directly correct the structural problems causing the symptoms, but they only modulate the level of inflammation and vascularity so that the body can possibly improve the anatomical problem causing the symptoms. The next two slides contain 10 key articles that have helped me to understand the mechanisms that these peptides activate to create the physiological environment to promote regeneration and healing. I have underlined 4 of the 10 references that are an excellent place to start. Additional information is available at the first URL, and the third URL will provide information on how to become a member of the Millennium Network. Thank you for watching, and please remember to like and subscribe to this channel if you have not already. Goodbye for now. Thank you.